Good morning.
Morning.
Talking with Dr. Ryan Allen, Assistant Professor in Environmental Health at Simon Fraser University. We're talking about chemicals and asthma. So, what are some of the chemicals that we can find indoors that cause asthma?
Well, there are several. One of the really important things about the indoor environment is it's actually where we spend the vast majority of our time. So this is a slide showing data from a Canadian survey looking at where Canadian children spend their time. And in the winter, kids and actually adults as well spend about 98% of their time either inside a building or inside a vehicle. Very little time is spent outdoors. In the summer we spend a little bit more time outdoors, but still not very much. And in fact, adults spend even less time outdoors than that. So the indoor environment becomes very important, both because we spend a lot of time there and also because if there's a source of pollution indoors, particularly an airborne source of pollution, the concentrations can be quite high because that pollution is going into a fairly small volume and there's relatively little clean air for those pollutants to mix with. So the indoor environment can be very important, and there are a number of pollutants that we either know or suspect to have links with asthma in the indoor environment. And I like to sort of think of this as kind of old exposures and new exposures. So what I mean by old exposures are things that we've suspected for a fairly long time, for maybe 30 years or so, to have links with asthma and other health outcomes. So those would include really any kind of combustion indoors. So environmental tobacco smoke is an important one. In smoking homes, in homes where there's a smoker, that source becomes the dominant source. It really sort of dwarfs all other indoor sources of pollution, as well as indoor gas combustion, so gas stoves, space heaters, those types of things. And then there are some what I think of as sort of new exposures, not in the sense that they really are new, but just that they've only recently gained recognition from the research community as potentially important exposures. So those are things like phthalates, which are synthetic chemicals that are used in plastics to make the plastics soft and malleable, cleaning products. And interestingly, there's now some evidence that swimming pool chlorine byproducts may be linked with asthma. So what happens there is that chlorine is added to swimming pools as to disinfect the pool, and the chlorine can react with other materials in the water or introduced by swimmers into the water to form byproducts, some of which are quite irritating. So there are a number of pollutants that we either know or we suspect are linked with asthma. Do
we know how they trigger asthma?
The mechanisms for some are better understood than others. I would say the strongest evidence of links with asthma, either causing asthma or irritating asthma, are for environmental tobacco smoke. So there's a pretty clear causal relationship between environmental tobacco smoke, or sort of secondhand smoke, and asthma. For some of the other exposures, the evidence is not quite as clear in terms of it being an important cause of asthma. For example, the sort of newer exposures that I talked about, the phthalates, the cleaning products, the swimming pool chlorine byproducts, there's some very preliminary evidence to suggest links with asthma, but a lot more research is needed before we can really answer that question.
One of the things that we tell people with asthma is that they should avoid their triggers. So how do people deal with avoiding these products when we spend so much time indoors?
Yeah, so I'd say certainly for environmental tobacco smoke should just be avoided at all costs, right? I'm not really going too far out on a limb there. For the other sources, I would say there's some simple things that you can do. Certainly when there's combustion, you can try to vent the combustion, make sure there's plenty of ventilation, or exhaust it, for example, a gas stove. Other things, for example, things that are related to particular behaviors, it may just be best practice to have the asthmatic individual in the home just avoid that environment during times when those behaviors are taking place. So, for example, cleaning products, when the cleaning is happening, it may be advisable to have the asthmatic
Mom,
child.
I can't help you dust. I've got asthma.
Right. So the kids will love that. And then the swimming pools are kind of interesting because there it's a bit of a delicate balance, because we certainly want to promote exercise, and swimming can be a good form of exercise, and is, in fact, has been in some cases recommended for asthmatics. So it may be that certainly for young kids, maybe 3 years and below, it may be advisable sort of as a precautionary approach to have those populations avoid swimming. For older kids, I think we still don't really know whether the potential risks of asthma are strong enough that we should actually be advising against swimming. I think that's still an open question.
Yeah, interesting. Anything else you want to add?
No, I think that's all.
All right, then. Thank you very much, Dr.
You're welcome.
Allen.
You're welcome.